The world is still concerned about COVID-19. There are other issues that still need to be addressed,
such as social issues that come with isolation for seniors and important decisions like picking the right Medicare plan.
We're going to spend a few minutes today talking on Living 808 about social isolation, seniors, and Medicare. And I have the privilege of talking with Jose Cabrera, director of the Hawaii Northern California Market for Humana, as well as Tracy Ann Chapkis, who is from Adventist Health Castle, the wellness director. So thank you both for joining me. This is an important topic that we'd love to address here on Living 808.
It's an honor. Thank you for having us.
Tracy Ann, let's start with you. I'd like to ask you, what do you think is the biggest single threat to our health and well-being right now during these COVID times?
2016 was a tremendous time when we learned from our United States Surgeon General, Dr. Vivek Murthy, that the biggest threat to our health and well-being is loneliness. We know that 25% of our well-being is related to genetics, but 75% is really based on lifestyle. So we have the choice on how we want to connect or don't connect. And if we don't, we're now facing something deemed the social recession. So now more than ever, especially for our kupuna who are physically distancing, we need to be aware of ways to cope and lower the chances of social isolation.
Now, what can people do to counter this threat, and how can Adventist Health Castle help?
Great question. So what people can do is really being very intentional, the people in their lives already, whether it's being old-fashioned and writing a note, giving a phone call, learning how to use Zoom. And for those who maybe are a little more extroverted, frankly, it's the people that you walk by through your neighborhood. I've met people in my neighborhood that I've never known lived in my neighborhood. So this is a great opportunity to connect. And at Adventist Health Castle, our approach to well-being is really helping people take the small steps to sustainable lifestyle change. So we're doing that now through phone, through Zoom, nutrition counseling, online fitness classes, 11 classes Monday through Friday, and we do diabetes management as well as tobacco treatment for free. And as far as social connection, Christmas is around the corner in about a month, and we're inviting the community to our drive-through party. We're going to feature roasted veggies and mushrooms with whole grain risotto, focaccia bread, and a chocolate brownie. So it's $8 per meal. It's a partnership that we're doing with One Word Community College and Hawaii Community Foundation. You can call us at 263-5050 to reserve tickets for yourself, your friends, your family. Give yourself a break from cooking. Enjoy the holidays, or email us at adventisthealthcastlewellness@ah.org and enjoy yourselves. Let's socially connect.
Jose, I want to get you involved in the conversation. We had a chance to talk recently because we know the Medicare, some prescription and drug plans, some important decisions. So what do you want our viewers to know right now as they start tackling this?
Yeah, it's an important time of year. I think it's for us, it's pretty exciting because this is when we get to sit down with folks and explain to them the different options they're going to have for 2021. We're currently in the middle of the annual election period. It runs from October 15th all the way through December 7th. This is the time of year when our kapuna get to go out there and find the information that's most important to them, so that way they can make the best decision for themselves going into 2021. So it's an exciting time of the year for us.
And is the enrollment somewhat easier since we're in this new virtual environment? We're communicating like this, for instance.
So what we did here at Humana, we conducted a market assessment, and through that assessment, we understand that, folks are more comfortable in the comfort of their own home. So what we have done is we've been able to train our force to be able to have virtual seminars, so that way our kapuna can still get that same information that they need to make the decisions for themselves. And then we are also made all of our agents capable of taking virtual appointments one-on-one from the comfort of their own home, so that way nobody has to worry about going out there to get the information that they need to make the best decision for themselves.
And last question, what support has Humana offered during the pandemic?
Some of the things that Humana did as a leader in the industry is go out there, and we've waived co-payments for those folks who believe that they need to get a COVID-19 testing. We've also waived the cost of care associated with COVID-19. So if somebody, if you think you may be impacted by COVID-19 and you're one of our members, you can go out there, get a test at no cost to you. And then the treatment, if you are diagnosed with COVID-19, is waived as well. And And some of the other things that we've done, we've expanded telehealth services across the islands. And I know something, here, on our islands that's so important is access to care. And we tried to make that as easy as possible for our members. And it's just our human care approach to things.
Well, we appreciate the chance to talk with both of you and everything that Humana and Adventist Health Castle are doing to keep everyone healthy and informed. So we'll post all the links on our website. Tracy Ann, Jose, thank you so much for joining us on Living 808.
Yeah, thank you for having us. Appreciate it.
Thank you.
There you go. You can be overwhelmed looking at these plans, especially as Kupuna have really been isolating. And so a lot of helpful links. We'll post that. Thanks to all of them for walking us through that.